TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us this morning is Waugh. Thank you, Crystal, for calling in.
Hi.
Hi. Good. Okay, today, Crystal, we're talking about PTSD, which affects millions of Americans every year. A lot of people don't know that. So first, tell us what PTSD is.
PTSD is post-traumatic stress disorder. It can occur when individuals have some sort of trauma in their life, whether it be from combat or domestic violence in their home or domestic violence that they've experienced. Even a car accident can cause it.
And what are some of the symptoms with PTSD?
Some of the symptoms are they'll have flashbacks where they actually relive the events of the traumatic event of what happened. They can also have anger, irritability. They may overreact to a certain scent or sound because it triggers memories of the traumatic event.
And how long do those symptoms last, Crystal?
It can vary from individual, but sometimes within months it resolves itself. Other times people for years can experience those symptoms.
Wow. So if someone has those symptoms, how can they cope with PTSD?
Doing meditation, deep breathing, learning what their triggers and warning signs are that a crisis is going to occur, that these symptoms are going to happen, is very important, as well as seeking treatment with a therapist to kind of process the events so that the trauma isn't as significant to them as it was previously. One of the things that they should avoid is drugs and alcohol. Those tend to exaggerate the symptoms rather than resolve them. But oftentimes people are trying to stop the symptoms, and so they'll turn to drugs and alcohol, but it's recommended that that not be what they use as coping.
So when they're suffering with these symptoms, when do they say, hey, enough is enough, I need someone else to help me out, I need a healthcare professional?
Yeah, when those symptoms are starting to have a negative effect on their day-to-day life, they're not able to go to work, they're not able to sleep, they're not even able to hold healthy interpersonal relationships, it's time to receive treatment. And you can do that with traditional outpatient therapy, but also here at McLaren we have a partial hospitalization program, which is an intensive outpatient program where they can come for a day, on average from 5 to 10 days, to receive intensive treatment with a therapist as well as a psychiatrist and nurses to address all of those symptoms.
So where should someone start if they don't have a healthcare provider, Crystal?
If they don't have a physician, they can always go to McLaren.com and find a physician to locate a provider in their area. Otherwise, they could call the partial hospitalization program at 989-667-6231 and talk with one of our intake workers, and we can help link them to services also.
And we want everyone to know there is help available, right? Tell us a little bit about that. What else we haven't covered that it's so important that people need to know? If I have PTSD, there is help.
There's absolutely help. One of the things that's most important with PTSD is talking about the trauma with a trained professional so that you can learn how to cope with those symptoms and find coping skills that help to reduce them, as well as medications sometimes that can reduce nightmares and other symptoms of the PTSD. But there's absolutely help, but a lot of it starts with asking for help and then being willing to kind of process those events that have happened to you.
So you are not alone. Help is available. Crystal, thank you so much for calling in today. We appreciate it.
Thank you.
You're welcome. If you at home want more information, just head on over to the Aging in Style page. That's on WNEM.com.